Joining me today is Dr. Kevin Parks, emergency medicine physician at San Antonio Regional Hospital. Thank you so much for being with us today, Dr. Parks.
It's my pleasure. Thanks.
Please talk about how you got the idea to become an emergency room physician.
Well, it was kind of the natural progression, I think, after being a paramedic. It was in the same general line of work. And when I went to medical school, I tried to pick something different because I figured it was kind of cliche to become an emergency physician. And I kind of liked a little bit of everything. And when I got done with it, I realized that's exactly what I liked, a little bit of everything, which is what emergency medicine is.
So give us a breakdown of symptoms that should be directed to the emergency department versus an urgent care facility such as Mountain View Urgent Care.
So chest pain, if you aren't sure what's going on, you should go to the ER. Strokes are another thing. There's a lot of programs out there to get people to recognize a stroke if your speech is slurred or if one side is weak or things like that. It's important to get to the emergency department. Don't go to the urgent care for those type of things. If you have a big, what we call long bone fractures, if your leg is crooked, you should probably go to the emergency department, as opposed to if your finger's crooked, you can go to the urgent care.
And what do you say to those that are exploring the prospect of getting into the medical field?
So I think that somebody who wants to go into medicine, they really, really need to put the work in to make sure that's what they want to do. If you do 4 years of college, 4 years of medical school, and then 3 or 4 or 5 years of residency after that, it turns out you don't like it, it's kind of a bad spot to be in. So one of the things that we've started at San Antonio some years back is a scribe program. And to me, it's a win-win. Their college students are thinking about going into medicine. They come and do our documentation for us. So I can talk to you, the patient. I'm talking to you, looking at you. They're doing all the typing, so I don't have to try and type at the same time.
Thank you so much for being with us today, Dr. Parks.
That was a pleasure. Thank you.
Latino Voices is produced by KVCR Public Media and is funded by generous support from San Antonio Regional Hospital, here for life. For KVCR News, I'm Yvette Walker.